Sharon, upright. Okay. And Sharon has the toothpick there too. Now that's a lot of times I just see that toothpick and I think, well, that's where it is, because Sharon put the toothpick there, but I'm depending on her. I had some assistants didn't know what they do and put it in the wrong spot, and I went for it and numbed up the wrong. I did that one time. Yeah.
So now you make sure you're always double checking that.
I'm just, well, before I was too, but it was just, I just slipped. Okay, open please for me, thank you. Now, some people, this we dry it with gauze first. I don't know if you saw Sharon, but she took a gauze first and dried it, and then put the topical on, which hopefully like helps the absorption of the topical, which we did. And then Tyler, I'd like you to open a little bit here now. Thanks. Now this is there's different ways to do this. One's like this shake, where you shake to distract them.
Okay.
Like that. And a lot of times I tell him I'm just doing this to distract you, even like he's like going, what are you doing to me? Yeah. And that's it right there. And just drop your shoulders now, let it go. It's just, and the little ones, I say, just like the movie, let it go. If you hold on to it, it stays with you. It's gone already, Ty. It's already gone, man. It's already gone. And the other thing, now that I got that numb, it was Dr. Sweeney, the old Dr. Sweeney in town. He told me what you do is you hold this here, and then you take the tissue and drape it over it like that. You pull the tissue over it instead of, he didn't feel, he was already numb. He may have felt a little push, but it's, open a little bigger, dude. Bigger. I gotta go way back here. Where? No, they help him open.
Open.
Tyler's not quite the man patient we thought he was gonna be here, man.
You want a little more? You want more?
You're killing me, man. I gotta focus on Tyler, get him out of here a little bit. I'm not gonna be able to drag it out too much.
You want more?
Like needles.
No,
More?
nobody does. I only had one weirdo patient like needles. He came in at 15. Yes, please, sure.
Okay.
He was 15. He asked me, give me shots, give me a bunch of shots. He was a weird dude, man. Okay, I gotta do one more. Open, please. This buckle here. Back, open, dude. Open, one pinch here and we're done. Excuse me. I just do that for the rubber dam ring, just to help him, because that ring's really tight in there. Okay, and then here's water. Get yucky taste out. Thank you.
Get your straw. Just
That
the straw.
exchange with that whole
Where's the
thing
straw?
too. I don't know if you got that, but there's a lot going on there, man. With Sharon, like we were doing that, nobody's moving, she's grabbing it, I'm holding still. There's a little dance that we've developed over the years. So that's complicated. So now let me see the rubber dam ring and the 3-prong. So the rubber dam ring, I just use this, I think it's 13A, is that the one? Yeah.
Or 8W, I don't know.
No, well.
I can't.
Yeah. Anyway,
I
this
have it
is the
written
only
down.
ring I ever use.
Okay.
Oh, there it is. I can't even see what it is. Oh, yeah,
Is
sure.
it 8W?
I think it says W8A
Yeah.
maybe. Okay, but anyway, this one's tight
Okay.
right here. But I take these 3 prongs. These are ortho appliances, and this has to be the right kind of metal. And I do go like this to make sure it's tight. So as they open as they get older.
Okay.
That's a 3-prong plier.
Okay.
See, 2 on 1, and that's what you'd use to bend like ortho wires with.
Oh.
I was I made retainers all through dental school, and I was the class wire bender. I was good with this guy.
We're checking on the sealants for sure.
We'll do them anyway.
Mary, we're gonna do them anyway.
We just bail them out. Open, please. A big, please. Now we want to see his tooth is buckle. So it's gonna push on your cheek a little bit here, Ty. Open, dude. Now, these under that light's gonna be washed out, just so you know.
Yeah.
And I can't shut off the light.
No,
But see, then I can push it with my fingers.
Okay.
So you're putting it on, and then you push with your fingers, and kind of goes over the height of contour of the tooth.
Yep.
Especially baby teeth have more of a height of contour than perms. Okay, open, dude, and my finger's gonna go back in your mouth, just a little awkward for 1 second, and then I'm gonna get out of it. This rubber dam is, and put your chin just to the right if you can. A lot of people can't do that, but Tyler did. Open, dude, open. Thanks. This rubber dam is a pain to get on, but once you do, we do like 99% of everything.
With the rubber dam.
Yeah. And it's a hygienic dam. When that aerosol you're producing, that's spraying all the germs in people's mouths in the air. these masks last, what did they say, like 3 seconds or something before they become moist and stuff goes through them.
Okay.
Even, you know, unless you get some really super duper, you know,
And I'm gonna get your little
first
tissue.
responder masks
Just a
or
little
something.
chair.
The ones they use here in
Oh,
the
watch your
hospital
lips,
are
watch your
junk,
lips.
from my understanding.
Your lips
You know, all
okay?
the leaks around.
Yeah. Yep.
So the point being, just try to keep it away from you. Don't think you're going to get it's better not to get spattered. It's
Okay.
better not to suck up aerosol that's being generated from. And Sharon's going to floss. If you floss the front one first, and that kind of stabilized thing, you can get the other
Okay.
stuff. One more there, Sharon. So the material I'm going to be using is called Activa. It's a new. It's like the newest stuff out. It's glass ionomer, has fluoride release. That's just dental floss, dude. Excuse the little surprise. Excuse me. The floss, you know, like Sharon hands it to me like that. Then a lot of times I'll put it around my fingers like this too to try to, you know. And then I'm trying to, you know, you hold a short piece when you floss. The patients too, so you're not jamming their gums.
Okay.
See how it jams in there? But if you hold it like that, it like super jams, which I might have done the first time. Excuse me if I did, Tyler. You're gonna owe Tyler. Oh, Uncle Cory's gonna owe Tyler.
Yeah, take him to get some wings.
Okay, back in.
Okay.
And then you rinse this out real well before you start drilling, because that's saliva back there, right?
Okay.
So actually Sharon does, and then he's getting numb now. They say, you know, it takes like 4 minutes is what I remember really to get numb to kick in. Some people, they're never going to get numb. Other people, you know, you need to give a little bit more.
More water?
And then I just use this small little, it's a diamond, like a quarter round diamond.
Diamond Day.
Yeah. And then this is called a scissorectomy, where pediatric dentists don't really do sealant. We do preventive resin restorations, really. So I just kind of scratch on the surface and kind of open up the fissure just a little bit to make sure that it's all nice and virgin white down in there. It's probably going to show up. It's going to be washed out from the... So I'm doing this while he's getting nice and numb still. Those look good. Then this one's tipped out way back. Excuse me, I'm going to be stretching your face. So we're having a tug of war with your face, Tyler. Hey, we're having a tug of war with your face. Sorry about that. Excuse me. So we're pulling your head this way, but don't let it turn, please. Thanks. Nice job, Ty. You're doing good. Give us a thumbs up if you're okay, mister. You all right? See, now a lot of times I'll say to a young patient, I'll say, I'm going to do this loud whistle. I put it up over here, make the noise over here, so I'm just going to use that, you know, tickle on your tooth. I'm going to count to 10, and I'm going to stop. So they know you're going to stop it when you get to 10, and a lot of times you can count like 1 Tyler, 2 Tyler, use their name. 3 Tyler, 4 Tyler, 5 Tyler. So we just scratch the little fissure, you know, see how nice that looks. And then the other one you can see a little brown spot on, may not show up on there, but
Yeah, I can see it along there.
See, and sometimes now that they said you can seal over incipient decay.
Really?
But I never bought it, man, because how do you determine if it's in the dentin or not? Incipient would mean that it's just in the enamel and hasn't penetrated through the dentin yet, but how are you going to tell me that? You know, by the time it shows up on a radiograph, then that's like a lot of the welfare, what insurance wants you to have it seen on a x-ray. By that time, you know, I'm catching this stuff early, you know.
Yeah.
So still, I just got that diamond now. And the diamond, then I'm doing like little subtle undercuts, like kind of like a 3. I usually always use the 330 till I started using this Activa. But then I got this little diamond, and it kind of wears out.
Okay.
A number 2, Sharon says it is.
Okay.
Sometimes when it gets shiny on the top, it means that the diamond surface is gone from it. But you also feel it just doesn't. So, you know, I'm going thing about that 330 burr, it's like 1.8 millimeters, which is the depth of the enamel.
Okay.
So this one's, probably like 1 millimeter,
Okay.
but I don't necessarily have to go. But see, I'm just kind of bumping on the sidewalls a little bit,
Yeah.
just to undercut it, because it's Activa. You need to undercut it.
Okay.
And then if there's like a little spot, this is like a little motorcycle like that. When you get the motorcycle out, bounce on your tooth. When you get the motorcycle out, you know you're almost done. And if it's a little spot, I don't want to go with I just kind of lay into it a little bit with this one, just to see, So I'm not using the high speed, because the high speed you lose your touch. This one you kind of have your touch, and if it's not there and it gets hard, it kind of doesn't cut it. The tissue, yeah, just like a round, slow speed, small. See, there's still a little brown in there. But instead of getting the high speed, I'm just going to try to find it and kind of rock on it. See what that looks like now? See, that's why I didn't want to seal over that. See that? That wasn't made with the burr. That kind of opened up and had like a little void in his tooth almost. Dry thing. Fluff. Just raise your finger, Ty. We'll get it out for you, mister. We know what you're talking about. If everybody has the same deal.
Oh, clamp.
Pardon me?
Clamp.
The clamp, is it bugging you?
What about, what
Is it pinching you?
it's open too big? Can you do that? Like that? Don't let your lips, you want to catch it with your teeth. Okay, I can close it for a little bit. When we finish up, we might have to open. Is that better? Okay, thanks for letting us know. Now we're going to get the etch out. Everything, they always teach about using 30% etch. My ever since I've been doing it, man, I use 10% etch. Because I'm working on young teeth. And it always just kind of, I just went conservative. I've never read a paper on it, but it's been working. And then I'm counting down in my head like 1 tie, 2 tie, 3 tie, 4 tie, 5 tie, 6 tie, 7 tie, 8 tie, 9 tie, 10 tie, 1 tie, 2 tie. Then I'm just kind of agitating this, because this can have air. When you put it, see, there's an air bubble right back there. I don't know if you saw it, but it didn't get down there because there was an air hole in it. So I'm kind of agitating it just to make sure it's getting all the surfaces for us. And we're not using that pop. If I was just doing a sealant, I use that new pop thing, what they call. Did you have that out, Sharon?
I still do, yeah. I don't have it out.
Where you just you can just like put it, paint it on, and it etches and bonds the tooth.
Mine stopped.
Bond the teeth.
Good call on.
Oh, good. Good.
Ran out of storage.
Yeah, that happened like that guy. So anyway, so that's about 20 seconds. Just kind of 1/1000, 2/1000, and that's lots of protecting the face here. Sunglasses are more for keeping junk out of the patient's eyes than for the light. Okay, a lot of water. Lots of water, real cold water. Getting close now. Giving your tooth showers like you're going to spray all over the place. Jesus. Going for those wings. You probably have to come back for another shower if you eat those wings, man. Yeah. But no chewing now. You have to take them for the wings tomorrow. Just take them for a milkshake now with a spoon or something, because this Activa, the light sets it up, but it cures throughout the day, they say. So usually I just always said, after like the composite, just wait till the Novocaine wears off. But now I saying soft stuff all day. Okay, now here's the thing. So we're doing this Activa. This Activa, man, you don't have to bond it. You can bond it, but you don't have to. So you want it moist. You don't want it dry. You don't want it desiccated. So I'm just kind of, Sharon had it about perfect there actually. And then this thing, the tip bends. So with glass ionomer, what I always learned was you want to have a bulk it up, and then set it up in bulk, and then it's stronger. Then trim it back down. not true with composites, but that's what I learned for glass ionomer, and this is a glass ionomer based product. So then you want it to sit there and soak for about 20 seconds.
Yeah.
So Sharon doesn't like me to goof around. So I left the tooth moist instead of using like a pre-bond. I just kind of leave it a little moist, and I do my own pre-bond like this. I paint on it. With the tooth was still wet with water. Did you notice that? She didn't dry it. She just dried and then this you get. So we're doing this while the Activa's setting in.
Okay.
Now I want to blow off the excess water and the excess bond on the sealant teeth. I'm blowing it off, and then we're going to do it again. And that's with fillings too. It's like usually with just the sealant, we'd use that pop, and it's a one-step deal. You don't even have to. But this, so now I'm resealing over that. What we had done before, and it's hydrophilic, so the bond's chasing the water right down into the dentinal tubules. That's why you want to keep it moist.
Noisy straw.
And then I don't want to blow my Activa though. And then I go. Now this stuff sets up. This is the embrace. This is BPA-free materials that we're doing, which parents with babies and stuff, they like. I mean, you know what people say when I say that? They say, thank you. That's what they don't ask about it. They just say thank you. And it's kind of tricky with this thing, trying to figure out, it's like having a fulcrum. Instead, you could probably just do it freehand. And then I just do one tooth at a time. And I used to have Sharon hand me an Explorer or brush to move the sealant around. But my light sets this stuff up. So now I just use this tip. And I try to get in the cracks and crevices, because she's going to replace the tip anyway. The tip's disposable. Then I just get that one tooth before I'd like seal all of them and then come back. And then the other thing is, now I didn't cure on a sealant. I didn't cure it. If it was a filling, I would have cured it and then put composite over it after I sealed. But this is what they call a wet seal. So I'm doing the bond it wasn't cured. And then one more way back here. It's wet, but I blew it off, right, with the air. I blew it off, so it's not like, puddly. And then the thing is, if you don't move it right away, like my light in my glasses sets this up. Okay, so now we're ready to go with the light. And then we just do low intensity. Like in 10 seconds, it beeps and it moves up to like a double the intensity, but then we just kick it back down to the lower intensity. And I tell people, don't look at the light, look away from the light. He can't see it because it's in his mouth. Usually if you do have like 4 teeth like this, you can, we do them together. The one that really needs the most is the Activa. And sometimes Sharon, because I can see great, she can't always see, so sometimes I'll help her. She's right on top of it now, but sometimes the assistant can't see your mirror, they can't see your handpiece, and they're just, because there's only so many, ways to look down inside that hole, and from their angle, they can't. So now we're curing this. Now you can, now what I'll do is I'll smooth the Activa, and if I don't like the margins or anything, then I'll put a sealant over it, but usually I don't. The thing is, this Activa, I'm not sure if the Embrace does, but Activa, it's fluoride release also. And when you brush your teeth, it recharges it with fluoride. Yeah, so it's protecting the tooth. Yeah, how crazy is that?
So how new is this?
It's pretty new, maybe 2 years or, yeah. The guy told me supposedly they're coming out with 2017 version that's even better, but it's by Ultradent. Took me a while. I was trying to find it with now, digitally, like you blow up stuff so big, like on the X, where you're looking at it, and then like you see a little void in your fillings now. And I just wanted something really opaque composite, and I was studying about opacity, trying to find the most radio. And then I was looking into materials. This one isn't what I wanted, but I found out how great it was, and that's when I switched. But if a patient's in like for a broken filling, then I use Ceram, which has like 400, I forget what it's based on, units. It's something like when you take a X-ray, we've got a step in there that shows like gradations of radiation, and it has to do with that. But the radio past, like maybe, I forget. But this is like 4, the ceramics, this is like half of the radio opacity. So it kind of looks a little, but those CEREC crowns, I had a patient with one of those the other day, and it looks like a ghost on there. It looks like it has like, yeah, it's really, I would not radio opaque at all. I was really surprised. I was trying to figure out what it was before I actually did. So now we just smooth them up. Almost done, dude.
Noisy straw.
Back in the back from this to tie. Okay, and then we just, I start like on the, now Tyler, we're back to open up big, dude. Excuse me. Got to crank it open here. Open a little bit more, one more. Okay. I'll get back there first, but that's where it's hardest. So I kind of start in the center and then sweep up. Same like, you doing alloys? But
I mean, we're gonna learn.
So anyway, you come from the center and sweep up. You don't want to come down and like tear into your filling. So you're kind of in the center. And then those, see, the sealants are, they're pretty much along the, I didn't overdo them, right? I didn't have to like do the bolt on them to strengthen. Actually, I wanted like to do the least amount of finishing, to get out the time that you could. But this one I bulked up, so now this one you got to be a little Michelangelo. And just moving that. And then I just use a large round bore. Now somehow, I don't know if you noticed, in the midst of all this, Sharon switched up. I never do either. Somehow it was a small round bore, and now somewhere in between she's got a large one on there. And the large ones are just kind of smooth. This is like what I actually do for polishing. They're going to make a big deal about polishing for you. That when you're on the clock, you're not going to be doing a lot of polishing. But you do want to make it comfortable to people's tongues. And a lot of times even we'll have it, in the old days, I was like, when I was in dental school, we were bare fingered. And you could rub it, make sure, wasn't any. But now, I'll have the patient lick it with their tongue at the end. Or, you can rub it a little bit. And then this, like I say, this is the motorcycle. We get the motorcycle out, means you're almost done. When we're riding them up and down the hills with your tooth on the motorcycle. Have you had any tooth streams yet where you're like sliding down the slopes of the tooth, Cory?
No, not yet.
Not yet, yeah.
I hope they're coming now.
They're coming, baby. Them dreams where like all your 6 incisors just all come out along with the alveolar bone. Yeah. Okay, then we'll take this off. Thanks, Ty. This you can, find the holes again, which is a hassle. Or you can go like that. And then we always check that all the pieces that you took through the mouth were coming back out. And open, we're going to massage this gum where that ring was. That ring's like goes way under the gum. Open, please. A lot of times they say they have a toothache, but it's just a sore gum from that ring. Catch your breath there, Ty. Yeah, I know. Still need to just check your bite, okay? You all right? Good. See that craziness? Sometimes you have to hold the light just right to see. You don't always. Some people have them like down here too. You have to hold the light. I call it like a crack in the windshield. I didn't see any other ones. And then, so we check the bite laying down like this, but also
now sit up
we
for
have
me.
them sit up.
Okay.
But the way you really want to do it when you're in
Chin
dental
up,
school
chin
is
up
you
down.
want to check it before you touch the
really
tooth.
hard.
Look at what their markings are before you drill on the tooth, before you numb them up.
See if we can get it back.
If when you're getting graded, you
Yeah.
can get those markings. I mean, you might even take a picture with your camera. I mean, if you're getting really graded, I don't know, maybe they won't let you have a
Your
camera
chin
in
down.
class, but the point is,
There you go. Now do it.
when he's numb and he's been sitting there for a long time, it stretches his TMJ muscles and, everything's a little kitty wampus.
Rub your teeth
So-
side to side.
Real hard tuck.
There you go.
Nice.
Good. Can you open? And go ahead and lay down again.
And then, so then, any big, you know, then we'll.
Just me strap.
Now, you want to open by yourself, or? So that pretty much says no, so get the tooth chair. So you just kind of see if you can trust them to open big, or they're tired, so, but I don't, that's just to help, so he doesn't bite down and ruin everything that we did. And then, you know, we're looking for now there is, we got a swap. Usually, no, that's right. It just looks kind of, so that you can see on the sealant down in there is marking it a little bit. This one, it's off the filling. This one's off the filling. So we're all
This isn't the way you change it.
on the filling. I'm looking if it's hitting my filling any place. I want him to hit on the natural too. Can't always do that. You know, this is like minimal. You know, with pediatric dentistry, the adult you're going to be hitting on your own filling a lot, but you want to kind of spread the force of the occlusion on other parts of it. See, that's all hitting on natural. There's none on my filling though.
Yeah.
The other thing is he has like a real sharp down here, like we call a plunger cuff, like you see some real pointy. So it'd be like the outer down here. There's something real pointy you want to just knock off the tip of it so it's not, you know, driving a dagger into your filling. And then Sharon's going to check your bite again when you're laying down. And then if you are hitting on a filling, it makes a dull sound. If you're hitting on your teeth, like if you chomp your teeth together right now, you kind of hear that sharp noise. So that's my final thing. You'll see. I'll listen for it.
Okay, and then.
Which I didn't learn that in dental school. I forget where. I just, you know, like I heard it and I just started hearing it. Like when somebody bit down, I go, well, that's it. That's what we're looking for, you know. So he's good now. So I'm just getting out this large round burr again. This is number 8, I think, actually.
Yeah.
The big round, slow speed, and just kind of polishing up. So I'm coming from down in the valley up the hill, right, pulling it up the hill. I'm not going down. I'm always going. I start like in the valley and then come up. Way back there. Excuse me, Ty. Nice job today, too. Thank you. And then nobody's really noticing that you cannot, you know, you can clean off those blue marks, especially if it's on the bottom. Or, you know, Sharon can wipe them off too, but. Now this, okay, and rest, please. And then tap your teeth together. Now, that can bend over like this. Let me hear you. Yeah, listen to that. You hear it?
Yeah.
Yeah.
Cotton pillow.
And then the
Find a
other
little
thing, so
pillow.
he's
That
been
just
laying
helps
down
you
and
don't
we've even
bite
had
or
his
stretch
head
your teeth.
tilted back. So a lot of, you know, they want to get out of here real quick, so we just have him
just
sit up
sit
and
up.
stay there so you don't get the
Just sit there,
postural
just for a minute, okay?
hypotension,
Just sit
right?
there for a minute.
Just sit there and breathe,
Yeah.
dude.
I'm feeling that.
Yeah, just sit there for a minute.
When it hits the